Hey, everybody. I'm Aditya Bansod, and welcome to Digital Health on Air. I'm joined by Ellie Powers, Chief Product Officer at Proov. Ellie has a wealth of experience in creating products that users love, probably something you've already touched yourself. And she brings insights from her past roles at Slack and Google to her current work in women's fertility and hormonal support. Ellie, welcome to the show.
Hi, thanks so much for having me.
So let's start. Tell us a little bit about Proov, how you made the pivot from big name brand health tech companies to women's care, and a very specific slice of women's care at that.
Yeah, well, I think if you have this hypothesis, I was just thinking about it this morning, that if you think about women who either went to work in women's health or founded women's health companies, I think if you could do a little bit of research, you'd probably find out that I don't know, I'll just throw it out there, 50% of them had a baby through IVF. And some bigger percentage of them had, if it wasn't that, it was some other problem.
Some assisted reproduction or whatever.
Yeah, something a little bit, if you think of the average experience, that they had something in their life around their women's health issues that was like 2 or 3 standard deviations away from a mean experience, right? Something where you go, okay, that was a little bit different. This became a much bigger theme in your life. And so for me, I had both of my kids through IVF. Sure. My second kid was born during the pandemic. And I think during that time, I turned 40, and like a lot of people at our age, I started thinking about what should I really do with my life? And to have that happen at the same time as the pandemic, it was like really a breeding ground for midlife crises, And I actually went back to my college reunion, the 23rd reunion at MIT last year, and it was super fun. I was asked to give a talk about, what did they call it? Career pivots and moving abroad, which are both things that I did.
And I was done. Yep.
Yeah, exactly. And then I was like, I know what they really want to hear about. They want to hear about midlife crises. So let's just call it spade a spade. And so I had a lot of fun writing kind of a comedy piece about that for my class. But that's sort of what it was for me, was like, actually, when I was in high school, I wrote my college scholarship essay about how I wanted to use technology to improve human health. But then I found product management in college, and I thought product management was amazing. And growing up in Silicon Valley, I was born about 5 miles away from Google's headquarters. Sure. It was sort of in the water. It was the terroir of the region, It was like there was tech stuff. My dad worked in tech. Both of my grandpas were electrical engineers. I was, maybe I was destined to go and...
You had it in your DNA, and
maybe
it was in the soil, it was in the water.
I tried to escape and I was unsuccessful. I mean, I'm not an electrical engineer, so I went soft.
You on that one. You at least got on that. Yeah.
Yeah. So, that was super fun. And it was really fun to go work in big tech. Health tech didn't really exist when I graduated from college. But it was always something in the back of my mind. So I think, when I'd been looking at making other, job changes over time, I'd always been thinking about, is this a time to go into health? And then I think by the time, a few years ago, it just became undeniable. I would try to get interested in other jobs that were really cool. And, I'd meet the people and they would be really great and they'd be working on cutting edge technology. And there's part of me that was really legitimately excited about it. And then there was part of me that's like, you know what? My brain just keeps going to women's health. This is just where it's going, whether I want it to go or not.
It seemed like an expression of your lived experience, right?
Yeah.
Lived experience that was around, as you said, how your children came into your life. And part of that seems to be very influential in how you made that decision.
Yeah, absolutely. And I think, you get to this point where for some people, they kind of move on after that. And for some of us that they're just
like that chapter's done. I got my kids. Let's keep driving.
Right, exactly. I remember when my husband and I got married a bunch of years ago, we came up with 10 different ideas for wedding related businesses that we could have started. Maybe you had the same experience.
You're in a wedding. It's like, this industry is insane. I'm in product. I could do this a little better.
Exactly. As a product manager, someone should fix this. But, I didn't start any wedding businesses, right? Neither did my husband. But, this was something where I just found it kind of always drawn to it. And so, while I was at Slack, I was having a great time and really loved working there. But, I saw that there were more women's health companies in this space. And I thought, actually, maybe this is really possible.
Yeah, I mean, there seems to be a Cambrian explosion of women's health companies, whether it's Maven or others like Proov, like yourselves, really kind of try to bring a more consumer experience, more consumer focus. So parts of women's health that I think have been historically expensive, time consuming, a bit of, I wouldn't call it gatekeeping, but hard to get access to expertise and that sort of stuff. So tell me a little bit why this focus you've taken is better, more convenient. How's this consumerization of women's care kind of making a difference in how care is delivered?
Yeah, I mean, I think it's been a really important trend, which is, I guess one thing I like to talk about is just, the space that Proov is in. It's about measuring your body, seeing what your body is doing, and finding ways to improve. But we're looking at women's hormones, and I think it's part of a bigger trend. I'm right here wearing my Oura ring and my Apple Watch, and
You
it's
have like a very standard, I'll make fun of you, the very standard Silicon Valley, like double wearables.
Yeah,
setup now.
it used to be worse. There was a time where I liked some things about the Fitbit better. So I had a Fitbit and an Apple Watch. No, a Fitbit and an Android Wear device. And it was very, very nerdy. But, I think what's so funny about a lot of things in women's health is like, I'm an elder millennial, so I can measure like 100 things about my body. I can have a pulse oximeter, I can measure so many different things with so many different devices. And then for a lot of women's health, you just go shrug emoji, who knows? It's mysterious, right? If you even think about like, hormones, the words that people use to me remind me so much of, do you remember that Barbie commercial a long time ago where the Barbie said, math is hard, let's go shopping?
Oh, yes. The infamous Barbie ad. Yeah.
Yeah. And so people, when they say hormones fluctuate, there's no point in measuring them. What I just hear is, I'm bad at math and I didn't even try.
Let's go shopping.
Right,
So
exactly.
maybe for our audience, tell us a little bit more. So what is Proov? Like Proov it is on a mission clearly to help women and their hormones and understand it better. But tell us a little bit more, because I think we might have jumped over that at the get-go.
Yeah, I think we did. Thank you. So what Proov does is, where we got our start was just helping people measure their hormones at home. So a lot of people may have taken a home pregnancy test. That's a urine-based test. You're able to measure the hormone HCG, which is created during a pregnancy. And then over time that evolved, and women were able to figure out when they were ovulating by using urine-based ovulation predictor kits, which measure the hormone LH. And then that testing has evolved. Our founder, Amy Beckley, created a way to measure something called PDG, which is a progesterone metabolite in urine. And the reason that that's important is the way that you predict ovulation is, LH and also estrogen. But if you didn't actually, you need to see whether your body actually ovulated. You want to.
Interesting. So what is ovulation? But it doesn't say that it actually happened.
Exactly. It just means you're trying. And in fact, some women see multiple peaks of these hormones. Some women have very boring textbook menstrual cycles and other women don't. And so it can be important if you're trying to get pregnant to see, is my body able to ovulate successfully? And there's a huge amount of conditions like PCOS, endometriosis, and more, sometimes thyroid issues, where women are not actually ovulating. And so doctors may have told them things like, well, if you're having a regular period, or if you're having a period at all, that means you're ovulating. Right. And that's actually not true.
That maybe covers maybe the 80% case, 70% case. And I imagine it doesn't cover everything, right? Which is why this is a rich and complex topic.
Yeah. And so I think what's happened over time is that women are seeing that they can get a lot of information about their body. It used to be that if you wanted to see if you had ovulated, you needed to go and have your blood drawn.
Blood work. Okay. Yeah.
Yeah. Your progesterone. And that was something that you could do with a fertility clinic.
Sure.
And there were some ways that women, if they were having repeat miscarriages or trouble getting pregnant, sometimes it would be due to a low progesterone issue. And that was actually something that happened with my mom. And so Amy Beckley invented a way to be able to measure progesterone in urine. And so what this meant, at home, exactly. So it's like less than $100. My mom would have been able to identify her infertility issue at home in one cycle, right?
And I imagine like that's actually, one of the things we talk a lot about in healthcare, and especially provider-facing healthcare, is patient access. And access doesn't just necessarily mean seeing the doctor, but it's also, can I do it at home? Can I do it on my schedule at an affordability level that makes sense for me, rather than shipping a blood sample to LabCorp or Quest or something like that? I imagine that's pretty much it's a game changer for women who are trying to understand and diagnose infertility conditions, doing the privacy of their own home.
Absolutely. And it also allows you to get more data points. Like if you think about, let's talk about like a CGM, a continuous glucose monitor, that is something that has gotten very popular, and it's gone from managing diabetes to now like something cool that you can try to work on your metabolic health.
I asked my wife if for a Christmas gift, I want to wear a CGM just to go check it out. And it was really, really nifty and completely useless for how I manage my day-to-day life. But like, it was a cool toy that I got to experience it. And I thought it was actually really a useful thing for me to just understand at home what my blood sugars and how they reacted to what I ate.
Totally. And you probably realize like, wow, those French fries are actually really bad for me. Like someone told me they were
I actually had a slightly different experience. I had a pack of Reese's peanut butter cups, and it had impact on my blood sugar. And I was like, am I a god? No. Like, what is going on?
I mean,
I
good
asked
for you.
No, and I asked a friend, and this is a quick aside. He's like, some of these things, it's just why some of these metabolic things are very, very difficult to understand because there's so many confounding factors. He said, while the sugars were high, the fats were likely very high too.
Yep.
And so there's a modulating effect that may not necessarily be intuitive. I was like, oh, that's so fascinating. And then I had another pack of Reese's.
That's great. And if you find out the Reese's is like your safe cheat thing, that's really great.
Yeah, exactly.
Maybe not the French fries. And when you have the Reese's and the French fries, you go for Reese's. So
tell us a little bit, like a product innovation, just like one thing you can think of that's like you've done at Proov or Proov has done since you've been there. We're like, you've made a big difference. Like this is really women's fertility, women's hormonal.
Yeah. Yeah. So I think there's been a couple things, one of them is we're really transitioning from being just about that hormone test and measuring your hormones throughout the menstrual cycle. It gives you a bigger picture, just like your continuous glucose monitor. If you measure women's hormones for one day, well, you might have noticed that women's hormones change throughout a menstrual cycle. So you need to get more data points. But once you get that, you can, take action. And like you talked about for at home, we started being able to give women treatments.
Interesting.
Using a doctor through telehealth. So it's not just, oh, you did this at home fertility monitoring and now you need to go find a doctor to help you. We can actually help you get a progesterone prescription.
You're trying out like, here's the data and now here's the so what.
Exactly. Like if your progesterone is low and you would like to try, a progesterone fertility treatment, which is a pretty low risk treatment, you can try it at home for, again, less than $100. And so that's pretty impressive for a lot of women. Like my mom had to go in multiple doctors, multiple miscarriages,
blood tests,
to be able to identify it and then have a doctor agree to treat, even though the medication is very low risk. Progesterone is a hormone that your body produces naturally. So one of the big things that we did in the past year was expanding from, just closing this treatment loop for fertility and then actually saying, these same hormones that we've been monitoring for fertility, they start evolving as you move towards perimenopause and menopause. So last year, we launched a fertility monitoring solution around perimenopause. So it's the same thing, the same 4 hormones that you need to measure for fertility. We're just measuring them again at specific times in the menstrual cycle. Because again, similar stuff, right? Oh, how can you know if in perimenopause? It's always a mystery. And yes, it can be complicated. But when you combine an app experience that can assess symptoms, assess menstrual cycle changes, and add in the hormonal measurement data multiple times in the menstrual cycle, you can actually have a pretty good idea. So if you go on
what's happening,
right, and you go on, YouTube or TikTok, there's lots of videos making a joke about how everyone says, "Oh, we'll never know if you're in perimenopause," and I think that's promoting that idea that women's health is somehow mysterious and clouded in darkness and unknowable. Right? We have chaos theory to predict the weather. We have people trying to predict the stock market. Those are chaotic systems, but we don't throw our hands in the air and go, they fluctuate, right? These are things that we can know about our bodies. And so this is really shifting that empowerment from outside, an external force, like, will I find a doctor? What do I even do? To here's something that I can do to investigate my body, and it can present me with insights into my body and then empower me with options that I can choose between. Maybe I want to take a supplement. Maybe I want to speak with a doctor and try HRT or hormonal birth control to control symptoms. Maybe I choose to do nothing but to continue monitoring and waiting for a future time. Maybe I can track my symptoms and see if they're improving or worsening. We've actually integrated that experience now with a lot of fitness trackers like Apple Health Kit. So now you can, have it monitor your sleep for you. And you can see, okay, I started treating my perimenopause symptoms. Am I sleeping better? Well, my Fitbit knows, my Apple Watch knows, we can know.
So there's a real nugget here that I'm hearing, which it seems to be a common thread through your experience, your family's experience, which is taking something that's been for lack of a better word, a mystery, or at least presented as a mystery, and illustrating with some science, some solid product foundations, some novel testing, that we can make a big impact in how people experience their fertility cycle, their menstrual cycle, their menopausal, their journey to menopause. Tell us a little bit more impact. What have you heard from your customers, the stories you've heard? I'd love to hear just in the wild, this must be so powerful for women.
Yeah, I think women didn't know that this was a thing that they could know about themselves. And it just reminds me, when they first brought the first pregnancy test to market back in the 70s, there was a lot of, questioning about should women be able to find out their pregnancy status on their own. Right now, we couldn't imagine that. Right, you can just go on Instacart, order a pregnancy test to your door at any time of night. Right,
Sure, totally.
Absolutely.
I'm like, it's just shocking that without having the background, the history of this, I can't even imagine that was something one would ask.
Right, isn't that amazing? And now so now women are having that empowerment. So here's some classic stories that we hear, is just that women say that this wasn't something that they thought that they could know. And a typical story of how a woman experiences perimenopause that we've heard from a lot of customers is, for a long time, your health just gets gradually worse in perimenopause. And you don't know you're in perimenopause. You might be 42 and you think menopause means age 50 and hot flashes. And you're not 50 and you don't have hot flashes.
Sure.
But you're waking up at 3 a.m. and you think you're stressed out. And maybe you're feeling a little bit more anxious than usual, but you think maybe it's about work or something with your kid. And then things get worse for you. And then you're 48 and you start experiencing hot flashes and you go, oh, maybe this is menopause. And then you go to a doctor and you get some treatment, whether that's HRT, birth control. Some people try supplements. And then you take them and you realize, oh, not only did my hot flashes go away, that joint pain that I thought was overdoing at the gym, gone. I'm sleeping through the night with no issues. I don't have an anxiety problem. That wasn't me. That just was hormonal in its origin. And so I think that's what we see. So really the vision that we have for our Empower product at Proov is, how do we find that woman 5 years earlier when she's just starting to sleep a little bit badly? Or how do we find her 8 years earlier where she goes, oh gosh, I just turned 38. Could perimenopause be starting? Let me track this. Just like I might go get my cholesterol tested at the doctor, get my A1C checked at the doctor, but this is something I can check at home. Just like my Oura Ring is keeping an eye on things about me. A woman now is really has the power to see how her body is changing, how her hormonal health is changing, and then decide when she wants to take action. And it really puts that control back on her side.
So one of the things that probably comes up here is, a woman going through the various products and offers that you have, the Empower solution for the perimenopausal woman, gets a bunch of data, has a bunch of choices to make with it, or non-choices. There's a lot of some intersection with your traditional OBGYN and the conversations they have around their annual visits and things like that. So where do you envision the future of, what I would call kind of non-traditional or new novel at-home self-discovery treatment options and kind of the regular, monitoring and care that a woman might go through with their OB?
Yeah, it's a great question. I mean, I think it's something where, when we as technologists see shifts in technology, there's places where they'll be adopted faster. Like I think a lot of these new health technologies are adopted with consumers first, and then we'll move on to, clinicians later. So we hope that in the future, there will be more comprehensive hormone testing available. We think urine can be a great way of doing it. There's also, novel solutions that are out on the horizon as well around even continuous hormone monitoring. So that's great. Yeah. I think in terms of a woman's relationship with her OBGYN, when a woman gets these results from us, a lot of times it makes her feel more motivated to go speak with her doctor.
I can imagine that.
That she's like, hey, I know I'll be believed now because I can show them something concrete. And I know, oh, I just knew that I had this symptom, but actually now I know I have 10 different symptoms I didn't even know were perimenopause. So it gives women the confidence to go and ask for what they need. I think it also provides, a lot of expediency. Not every OBGYN is going to be menopause trained. They're not all going to be up on the latest stuff. There's sometimes where you do really want to go and have an in-person OBGYN. If you're having, like a lot of women get heavy bleeding during perimenopause, it's important to go and get checked out and make sure that's not fibroids or something like that.
More serious, yeah.
Exactly, because it could just be a hormonal issue, or it could be something that might need, even surgical intervention. So having that in-person appointment can be really important, but some of these things can be handled by people who can really develop great expertise and potentially do that through telehealth, because not every woman is going to know. I actually got an email from a former coworker, like asking me who I know in San Francisco, who's the best doctor to go speak to in person about HRT options. I told her, I actually don't know. I don't know, you know?
I don't have a special like Rolodex here that I can pull from.
Right. I was like, I should know that. And I actually don't, you know? And I think that's where a lot of the online services have come in, is that I think women know that when they go to those services, they know they're speaking to an expert. And I think that they feel that they'll be believed. Yeah. You know, that said, there's a lot of OBGYNs who are training in perimenopause and menopause now. And so I'm optimistic that over time, there'll be a lot more options. And I think we see the same thing through fertility, although with fertility, you know, I think that in-person care can be very important as well. So I think it really is about giving women options so that she knows she can move forward in one way or another. You know, a lot of people just get stuck even for months because they're not sure which doctor to go to, right?
I can very much relate to that, having, you know, my wife, I mean, I think every woman I've ever spoken to that I can't get in front of the OB when I need them. And when I get in front of them, I'm just beginning a long journey around testing and this sort of stuff to get to an answer. Where I think what you guys are doing now at Proov really can maybe flip that model a little bit, where you get some of the answers first and then go have a conversation on treatment plans, and really shining a light on, you know, not, you know, making it so, you know, these hormonal issues are not opaque black boxes, that they can be influenced with data, they can be fed with knowledge and information that you guys are starting to provide.
That's right. I think that's very right. And it can really help women, you know, have more time to learn. One thing we heard a lot, especially in the perimenopause space, is that women are just hungry for knowledge, and they're hungry for, you know, medically accurate knowledge. And, you know, if you're going to move ahead and start treatment of some sort with your perimenopause symptoms, a lot of women want that time to consider and go, oh gosh, I didn't realize it could be perimenopause. I need some time to digest.
Well, it's not like you said, it's like, oh, I just thought I was having some joint pain. It turns out it's actually hormonal perimenopause, and that's actually what's
right.
Knock off 5 things that I thought were just the signs of aging. Well, it just turns out some HRT could have helped me with that.
Right. Let's not suffer for 5 years before we find that solution.
Yeah. I love that. That's a fantastic like one-liner to close on. Let's not suffer for 5 years to find a solution. Ellie, thank you so much for spending a little time with us today on Digital Health on Air. Really incredible conversation around the work that you're doing at Proov to kind of shine a light onto the work of hormonal issues in women and help women live better lives. We really appreciate you, and thank you for spending some time with us today.
Thank you so much for having me. It was great to chat.
All right. Cheers, Ellie.
Bye.